Hi, my name is Shelby. I have my patient here as Ivy, and we're going to be performing an HEENT assessment today. So I've got my otoscope and my pen light ready. My patient appears to be in good general hygiene. Her clothing is appropriate for the season. Her skin color looks normal, not pale or ruddy. She has a straight upright posture. Shoulders are even. She has a good affect. Her mood seems to be in good condition today. She has clear speech and clear hearing, and her nutritional status seems to be adequate. I have washed my hands and provided privacy for the assessment today. So first I'm going to start with the head and face assessment. She appears to have an appropriate level of consciousness, alert and oriented ×4. So can you tell me your name and date of birth?
Ivy Schulte, 3/27/86.
And do you know where you're at today?
My house.
And do you know what year it is?
Yes, 2018.
And do you know why you're here today?
Because I have to be. To do this assessment.
So my patient appears to be alert and oriented. Now I'm going to inspect her scalp. There doesn't appear to be any lice. Hair doesn't show any nutritional deficiency. Her cranium is even on all sides and it's rounded. She has facial symmetry. And now I'm going to feel for her temporal artery. They appear to be 2+ and normal rate and rhythm. Now I'm going to have you open your mouth and close it, and open your mouth again and close it. So right then I was checking her temporomandibular joint, and I had her open and close the mouth to see if it was swollen, and it was not. So now I'm going to check your maxillary and frontal sinuses. Can you tell me if you have any pain or pressure?
No.
All right. So that concludes my head and face assessment. I'm going to go ahead and go with the eye assessment now. So first I'll test her peripheral vision. So I'm going to start with my hands over here and tell me whenever you can see them.
No.
Okay. And then now tell me whenever you can see them if I go up and down.
Yes, I can see them.
Okay. And again.
Yes, I can see them.
So her peripheral vision appears to be intact, doing it laterally and up and down. So now I'm going to go and look at her eye structures. Her sclera is not yellowed, it is white. Her conjunctiva is pink on both sides. The corneas appear to be intact. So now I'm going to go ahead and test your 6 cardinal positions to test your cranial nerves. So I'll start with my finger like this and follow my finger. I'll go to the side, up, down, in the middle, and back to midline. And then go to the other side, up, down, middle, and back to midline. Good. Now follow my finger towards your nose. All right. And now look at my finger. Look at the wall behind me. And now look at my finger. Good. So her eyes appeared to, all 6 cardinal positions were intact. Her cranial nerves are intact, 3, 4, and 6. I checked for convergence and accommodation, and both of them appeared to be adequate, and she passed the test. So now I'm going to shine a bright light in your eyes and check your pupil sizes and see if they react. I'll shine a bright light. And I'll do the other side. Okay, so both pupils were round, equal, and accommodated to light. Both eyes accommodated whenever I would shine in one eye, the other eye would accommodate, and same with the other eye. And if I was to test her vision with a Snellen chart, I would have her stand 20 feet away from the chart and have her read the lowest line that she could. And 20/20 would be perfect vision for that. And that concludes my eye assessment. I'm going to go ahead and check her ears now. So first I'm going to inspect her external ear to see if there's any lesions or drainage. Her right ear does not appear to have any crusting or drainage coming from it. Check her left ear. Whenever I pull on your ear, does that hurt at all?
No.
So I checked that to see if she had any problems with the ear infection before I actually shined the otoscope into her eye, and it did not hurt. So I'm going to go ahead and assess the internal ear. So I'm going to pull your ear up and back and look in your ear. Now I'll check the other ear. And all internal ear structures appeared good. I checked her canal. Her canal was not reddened or anything. And I also checked her tympanic membrane. It did not appear reddened or bulging, which would indicate inflammation or an ear infection. It was white, which it is supposed to be. So now I'm going to do the voice or whisper test, and I'm going to whisper a word into your ears on both sides, and I want you to repeat what I say back to you. Now I'll check the other ear. So she appears to have good hearing. If I had a tuning fork, I could do the Weber test. However, I do not have one of those. So now I'm going to go ahead and check your nose. I'm going to shine a light up into your nose, and I'm going to check for symmetry, lesions, see if both nostrils are patent, if you have any nodules in there, and also check the mucosa in your septum to see if it is not deviated or anything like that. Okay. There does not appear to be any swelling or drainage, no lesions. Have you had any history of breaking your nose at all?
No.
Okay, so if she was to ever need any sort of NG tube or anything, both nostrils are patent, and the mucosa is pink, as it should be, and her septum is intact and not deviated. So now I'm going to go ahead and go to the mouth and throat assessment. So if you would open up your mouth for me, I'm going to check your mucosa, your tongue, your gums, the floor of your mouth, and your upper palates, both hard and soft. And then I am going to check your tonsils as well. So if you could stick out your tongue and say ah.
Ah.
And lift up your tongue. Good. So after inspecting her mouth, her mucosa is pink. There is no white patches, which should indicate thrush. Her tongue is not white. It is a pink color, beefy red, as it should be. Gums are not receded or swelling, which would indicate gingivitis. Her hard and soft palate do not have any lesions on it. Her uvula is center and it moves with voice. And her tonsils are not inflamed. She has never had a tonsillectomy, and they do not appear to be inflamed at this assessment time today. So now, after checking for her cranial nerves 9 and 10, I asked her to stick out her tongue and say ah. So those nerves appear to be intact and working. Can you stick out your tongue for me? And very good. And so that is checking cranial nerve 12, and she passed that test as well. So now I'm going to move on to the neck assessment, which is my last one. I'm going to inspect for symmetry, masses, pulsation, and jugular venous distension. After looking at her neck, she does not have any jugular venous distension, which would indicate edema or heart failure. So I'm going to go ahead and assess her lymph nodes and palpate those using my first 3 fingers. I'm going to do the preocular or auricular, post-auricular, the tonsillar, submandibular, the submental underneath the chin. And I'm going to ask you to turn your head to that side, and I'm going to check for her deep clavicular. And now the other side. Okay, now face forward. Now I'm going to check for the supraclavicular. And the infraclavicular. So all lymph nodes appear to be pea-sized. They were mobile, not stationary. If they were stationary, that would indicate that it would need to be inspected further, but they were all mobile. I'm going to go ahead and check her carotid pulse on both sides. They are equal to plus bilaterally. So now I'm going to go ahead and check your trachea and your thyroid. So I'm going to go ahead and stand behind you, and I can feel the cricoid notch. And after moving it back and forth, it moves very smoothly. I do not feel any goiter, and the trachea is not deviated. If you can go ahead and move your head like this, and twirl it this way, and twirl it the other way. She has full range of motion in her head, muscle strength, in head and neck, the muscle strength is adequate, and that concludes my HEENT assessment on my patient Ivy today. Thank you very much.